Hi everyone, I'm Dr. Amel from City Skin Clinic. First of all, Happy New Year. I know it's been a little while since the last video we put up, but it's been a crazy busy time. So thank you for bearing with, and thank you for all the supportive comments that everyone's been leaving on our channel. So to kickstart the new year, I thought I would do a video on a subject that quite a few of you have been asking, and also we've been getting the same kind of questions on social media and of course in the clinic as well. The question is, which is the best filler for me? And by that, most people want to know which brand of filler, which type of filler. Some people think it's all the same kind of filler. And so what I really want to do is just go through what I think are the best type of filler you should be considering for each treatment, or rather your doctor should be considering, and why we use the fillers that we do in the clinic. I'm mostly going to mention the brands that we use in the clinic. There are lots of other brands and lots of really good reputable brands. I may just kind of mention their names, but I'm going to focus on the type of filler that we use in the clinic that I know really well and that I stand behind, but that doesn't mean that there aren't any other good brands, because there certainly are, but this is just what we use and we love using and will continue to use. So before I get going, if you're new to our channel, welcome. Please don't forget to like this video at the end, to subscribe to the channel and ring the notification bell so that you're aware of when the new videos are. And if you're returning, welcome back and thank you for all your support. So let's get started. Types of filler. So right now I'm only going to focus on hyaluronic acid fillers. Anyone that's watched any of our videos about fillers before know that I'm really keen on strictly only using hyaluronic acid dermal fillers, particularly in the face area. I do make an exception for radiesse in the hands, but really anything in the face and neck, it has to be dissolvable. It's the safest way to approach this, and I don't think there's really any reason to use non-dissolvable filler. And so hyaluronic acid fillers are awesome. There are other videos, we'll put a link to them, where I go into detail what they are, but this video is really about what the different types of hyaluronic acid filler are, and which ones I think, and from experience, use best for certain types. So we'll go through the best kind of filler for the under eye area, so the tear troughs. We'll go through the best type of filler for lip enhancement, and then best fillers for the cheeks or the mid-face, the nose, wrinkle filling, and for the chin and jawline. The main brands that we use in the clinic is really mainly the Juvederm family of fillers, but we also use Teosyl Redensity 2 for the under eyes, and we also sometimes use Belotero for the lips. All of these are really premium brands of filler. They're incredibly famous. They've been around for a long time, so these are the reasons we love using them. There are also other really reputable brands like Aliaxin and Restylane, which is also reputable. We don't use that in the clinic. Nothing wrong with it, but you always have to stick with what you know and love. And so I'm going to talk about the brands we use, and happy if you want me to go into detail about the other brands available, I can do that in another video. So let's get started. Best type of filler for the under eye area or tear trough correction. This area is incredibly delicate. It is thin, the skin underneath it, there's no fatty layer really to speak of. It's an area where if you get water retention, you'll see swelling and puffiness, which will look like bags. If you have filler that's too superficial or too thick, especially if you have fair skin, then that can appear as a bluish discoloration. And it's an area where there isn't a whole lot of space. The hollows are not that big compared to when you have hollows, for example, in the cheek area, the mid-face area. So for this reason, you really want to use a filler that is thin, so not too thick. You want a filler definitely that does not draw a lot of water, because what you're looking for isn't volume per se, you're just looking to correct a hollow and support the skin. For this reason, Teosyl Redensity 2, it's specifically designed for use in this area, so it won't attract water. It's a really nice thin filler. If injected in the right layer, it's not going to give a bluish discoloration, it's not going to look visible as a filler, and so it's really ideal. And even better, it's the only filler that's licensed for use in the under eye area. So this is the reason that we always use Teosyl Redensity 2 in this area, and we've only ever used Teosyl Redensity 2 in the clinic for tear trough correction. Teosol Density 2 also does have some peptides and vitamins in it that are supposed to help brighten the under eye area. But to be honest, the main way you improve under eye circles and hollows is by treating the tear troughs, and that's the main reason we use it for this area. We don't use Teosol Density 2 for any other area, although Teosol make other products for the rest of the face. And that's one reason I really wanted to do this video, is to show you that the best filler depends on what you're trying to achieve and where you're trying to inject it. Lip enhancement is another really popular area, and there are a few options here. So we'll use something like Juvederm Smile or Juvederm Ultra, and these are two nice fillers. They're thick enough to use in the lip area if you want to get a bit of volume, a bit of shape, but they're not so thick that the lips end up looking and feeling stiff. And they're kind of basic fillers. They're good if you're looking for a little bit of correction, a little bit of touch up, a little bit of shaping. The next step up from that is Juvederm Volbella, and that's a really beautiful filler. It lasts longer than Juvederm Smile and Ultra. It is just super soft. It's really natural feeling. It's a very smooth filler, so I love it for this area, and it's great if you're trying to achieve a little bit of shaping, a bit of definition and a little bit of volume, but still keeping it natural looking. Belotero Shape and Belotero Contour are two other amazing fillers that we love for the lip area, and they're also designed specifically for this region. Belotero Shape, again, because of the name, it's really good for shaping the lips. It's good for providing a little bit of plumping. Belotero Contour is really good for definition. It's good for lips that have lost that kind of definition, or you want to make them sharper, you want to focus on certain areas. It's really good for that and the outline of the lips. If you need a bit of both, then we combine both Belotero Shape and Contour to do a really nice but natural looking lip enhancement as well. So as far as I'm concerned, those are the fillers that we use in that area, and we've had amazing success with that. And the important thing with the lips is that the filler used provides what you need, the shape and definition, but you don't end up with a filler that's too firm, that feels unnatural, that makes the lips look so swollen, they look really tight and sore and painful. And you do that by choosing the right filler, but also making sure that your injector works mindfully towards having a natural looking outcome. Moving on from the lips, there's the mid-face area or the cheeks. So a couple of reasons people might have filler in the cheeks. For us, younger patients tend to want filler in the cheek because they want a bit more definition, they want a little bit more enhancement, just to really get that kind of contoured but still natural looking structure to the face. Older patients often want filler or need filler in the mid-face area, just to restore the lost volume, give the face a little bit more of a youthful look, and just to kind of freshen up the face a bit. In both cases, we tend to use Juvederm Ultra as kind of the standard filler, and that's a really good, especially Ultra 4, it's really good for achieving a bit of definition, a bit of shaping of that area, and restoring volume loss. If you are looking for something that is a little bit more shape and definition, then Juvederm Voluma is amazing. It lasts longer than Juvederm Ultra and gives a bit more volume and a bit more shaping and definition per mil of filler. And so that's a really wonderful filler, and we use a lot of Juvederm Voluma in this area and in the lower face. The same with wrinkle filling. So if we're filling deep wrinkles, like the nose to mouth lines, like the marionette lines, the kind of lines underneath the mouth, or jowls, then sometimes we'll use Juvederm Ultra for, it's really if, you know, there might be a small line that's kind of just appearing, or someone who maybe wants a little bit of an outcome but not to really completely smooth the line, then, you know, Juvederm Ultra is great. If we're looking to kind of fill in deeper lines, deeper hollows, then Juvederm Voluma or Juvederm Volift are fantastic. Again, they provide more volume and they can fill in a little bit more than Juvederm Ultra 4, and they last longer as well. And then that brings me to the jawline and the chin. Here again, if you're a younger patient, often you're probably looking for definition, a bit of enhancement in that area, whereas older patients tend to want to just help reduce the, I hate to say it, but there may be a little bit of sagginess in that lower line, loss of definition. In older patients, we're often combining it with the mid-face as well. But in that situation, so Juvederm Ultra, again, will do the job. It's a workhorse filler, it's a great filler. But if you're looking for a lot more definition, a lot more sharpness and contouring, and for something that lasts longer, then Juvederm Volume is amazing, and that's probably the most common filler that people go for. Juvederm Volux is a filler that is new on the market. It's been around for a year, or a little over a year, and that's increasing in popularity because it provides even more volume and definition and hold than Voluma, and it lasts almost twice as long as Voluma. So Volux is incredible. It's specifically formulated for use in the chin and the jawline area. And then when you come to bits like the nose, so non-surgical rhinoplasty or non-surgical nose reshaping, that's again a special area that's like the under eye area, where really we like to use a filler that is not going to migrate, that's not going to cause too much fluid retention, and it's also an area where you want a filler that is thick enough to keep the shape. So in this area, most of the patients that we see we will treat with Juvederm Voluma because it's a great filler. It lasts in that area, you know, sometimes up to a year, and it gives that hold. In some cases where there's a lot of work that needs to be done, a lot of shaping and structure, we may even use Juvederm Volux in that area. So this is just a really quick whiz through as to the types of filler that we love to use in the clinic, that I personally think are great for the treatments that we do, and from the experience we've had, they provide terrific results. I'm always open to looking at what the latest treatments are, but I'm very fussy about what we introduce in the clinic. And so these fillers are really ones that I stand behind and I love. Like I said, there are lots of other great brands on the market, and all of these brands also do other types of fillers, but these are the types of brands and the types of fillers that I prefer and that we use in the clinic for those specific areas. Anyway, let me know if you have any questions in the comments below. I'm also going to leave links to these specific products that I've mentioned, just if you want to have some more information and to read about them. And let me know what you think of this video, if you have any questions or other topics you'd like covered in upcoming videos. And please don't forget to like this video and subscribe to this channel. Until next time.